Dr. Robert Gray. I specialize in facial plastic and reconstructive surgery, and I have offices here in Manteca and also in Pleasanton. So as mentioned, I'm dual board certified in head and neck surgery and facial plastic and reconstructive surgery. Okay. And the topics that we will review will be ranging from the non-surgical services, which include Botox, Restylane, fillers, permanent, laser treatments called IPL photofacials. There's a skin tightening device called Thermage, laser hair and spider vein removal, facial resurfacing, and overall just good skin care. And as mentioned, I do surgery. So of course that encompasses everything from eyelid surgery, nose surgery, facelifts, liposuction, ear surgery, scar revision, mid-facelifts, endoscopic brow lifts, facial implants. So hopefully my background and training will tell you what works and what doesn't work. You know, there's a saying that if all you have is a hammer, everything in the world looks like a nail. Well, I feel like I've got a full toolbox of choices, and hopefully I can impart some of that to you guys. So, as was mentioned in the introduction, it's in the news, it's on the media, and everything that you read. It can be very confusing. When I go to meetings and there are 1,000 lasers out there, you don't even know where to start. But I have a lot of experience in all of this, and I can kind of determine what's good and what's bad, and hopefully I can help you decide that as well. So it's pretty straightforward how the aging process starts. Basically, in summary, it kind of just starts in the eyes. And then it goes to other parts of the face, but the eyes are some of the first areas to start, with drooping and some little crow's feet lines on the sides, and that little leaden line that we develop between our eyebrows. And then it can advance and extend to, in our 40s, our brows start to get a little bit heavy. We're not really seeing much of the nasolabial folds, but we can just a little bit here, early jowl formation. And then in the 50s, the eyes and then other parts of the skin are starting to notice some changes, the deeper creases in the face and skin, and the jowls, and start to get a little laxity in the lower neck area. And the 60s, technical difficulties here, just increases that. So it's basically, think of gravity and think of everything kind of heading south. So we'll talk and review a little bit of the surgical services that we offer, and then non-surgical, and then hopefully I'll be able to differentiate the two. So obviously rhinoplasty is something that I do all the time. You've only got one nose. It sits right in the middle of your face. You can't cover it up with a shirt. You can't cover it up with glasses. It's right there for everyone to know. So that can attract a lot of attention if it's too big, too small, things like that. So that's a common procedure that I do. And try to advance that slide again. So I'll be showing you some examples of that. My goal, anytime I do any kind of facial rejuvenation surgery, is so no one will really notice. Okay? It all looks very natural. You just look refreshed. I have so many people that will come back after their procedures and say, no one noticed, but everyone complimented me on how well rested I look. What did I do? Lose 15 pounds? Am I starting to work out? You know, and it's just like a little secret. It's come to find a little secret. And I have examples on my website at mdlaserspa.com. Next slide, please. And next slide. And here is a gentleman, next slide, that came in. He had a pretty prominent tip and edge of the nose called the nasal dorsum, and he just wanted it to look a little very natural looking nose. He still has a masculine look to him. And next slide. Chins. We don't really usually think about our chins, but our chins actually have a lot to do with the way our profile looks in our neckline. Some people with no chin, the chin blends into the neck and helps to draw attention to the neck, when really the problem might very well be the chin. And here are examples where you might think, oh, look at the differences in noses. No, really, those noses are all the same. They're just differences in the chin. And from very recessed on the right to less recessed on the left. And here's an example of a gentleman who, secret, a lot of the guys that wear goatees have small chins, except for me. But, and they'll just try to hide that to make it look a little bit more balanced. Facelift. There are whole different kinds of facelifts out there these days. There's short scarf facelifts, a whole bunch of different names. So just basically, if you think of it, forget about the names. There's a mini lift, and then there's a full facelift. And that really answers everything that you might want. A full facelift obviously takes a little bit longer, and it's for people who might be, late 50s, 60s, having a lot of changes in the neck and upper face. Then there's the mini lift, which is very simple to do. It takes an hour and a half to do. And it's more so where the neckline's fine, you're starting to get a little bit of laxity here in the mid-face. Okay? All these people came up with all these little fancy names, but there's really only two kinds of facelifts: mini lift and full facelift. But it can be very dramatic. I'm kind of partial to surgery. I like surgery. I think it works great. And but there's a lot of people who that's a four-letter word to them, and they don't even want to consider it. So we've developed all these other options for people to consider. So here's an example of a lady. Look at that neckline. That's greatly improved. She was in her mid-50s. Here's a lady. This is dramatic. This is dramatic changes. You cannot get that with any laser. That's the same person. Left is before, right is after. She was actually a grandmother in her 60s, and she acted like a 25-year-old. So she had so much energy. It was amazing, and just wasn't shown that on the outside. So she wanted the outside to match the inside, and now it does. And she's very good. Or, if that isn't fit your budget, it's certainly just I'm sure it's out there. And for the guys, I was in the newspaper a few years ago about senior citizens, what kind of procedures they're having. And this guy only cared about his neck, he couldn't button his shirt. And next slide, please. And I kind of refer to that as a term called a little turkey goblet. So that took 1 hour to do, and he is very delighted with the procedure. Okay. Next, we're going to talk a little bit about liposuction. Sometimes it's not just skin, but it's skin and fat, and you gotta get rid of that fat, and that's 20 minutes in the OR for that. And she had a little chin implant, and look at the big difference. Talk about that chin that blends into the neck. Now she's going to have a neckline that's going to be much better to hold her whole life. Eyelid surgery, as I mentioned earlier, that's one of the early changes that we have with aging. And your eyes tell a lot about you. You're looking at people, and if they have dark circles under them, or they look tired, they're like people think you might be angry at them, and you're not angry. They're asking you, are you tired? No, I slept fine. I'm sure we get that. And I'm 45. I definitely get that stuff. So, okay. And here are some examples of people that had procedures to correct that. So, hour and a half to go from the left to the right. She just looks much more alert. She was late 40s when she had this. And she's delighted. It just looks so much more restful for her. Next example, a lady in her early 50s. Okay, I can't back that up. Just much more alert.